Helen. And we now are moving to the next speaker who just came out of the, the practice now. It's Dr. Paolo Sassu. He's a senior consultant on hand surgery at Sahlgrenska University Hospital, as well as the director of the hand transplantation program at Sahlgrenska.
Okay. Thank you, Max. Thanks a lot. So let's see. There might be a light also here. Yes. Thank you so much, Max, and the whole organization. It's very a good opportunity for me to speak about what we do together, a bit of our projects, just a brief story of what we've done in the last few years. I put my name here in my presentation, but I really have to share not just with Max and Max teams, but with my wonderful colleagues in the hand surgery department who have helped us and helped me so much in the hand transplantation project in every single step. It's always hard to start a big project in a new country, and for me, when I moved, and all my colleagues were extremely dedicated to help with the development of this new adventure. So I really owe them a huge gratitude. When I came here, my education was mainly based on autologous reconstruction, I have to say. So I was very much focused on transplantation. Mainly because I didn't know how much potential there was on the other side, and so I never considered very much the possibility of working with engineers, bioengineers. So I focused very much the first few years in developing with my colleagues the hand transplant program, thinking that that was the way and the best way to replace an amputated arm. And then I met Professor Bronnemark, Max Ortiz, Catalan, who opened a huge door in this new field, and I'm very grateful because we've been able to build up a program that actually has brought up both concepts of autologous reconstruction, artificial reconstruction. So I'm very grateful that I could open my mind to new things. And the main reason why I wasn't much into, let's say, bioengineering, because I thought prosthesis would just, sort of suck, or there's not really good. They can never be compared to an autologous reconstruction. And all these problems that I've written here pushed me always towards transplantation instead of reconstruction. But then I've really seen that these two fields don't really go one against the other, but they really can work parallel, depending on which type of patients we have. They involve a huge amount of persons around, single patients sometimes, especially talking about transplantation. But so they're demanding in the organization process, but. It's interesting to have one place where we can offer the patients, depending on what the needs are, different options. As I said, a huge part of the problems that I wrote just before were improved so much by Richard Bronnemark and Max, and to me, knowing them has been really a new adventure. So I'm really thankful. For their work together. I'm not going to talk much about these things that you've seen already from Max's team, but so much advantages in implanting, electrodes directly on the muscles, and I can, see from the patients that we've done in our outpatient clinic how much better they function with this new method. And this is just one of them that I met. In our outpatient clinic, and how much easier it is to wear a prosthesis and to make it work right away. It's really inspiring in this new field. again, things that you've seen already from Max team, so I'm not going to talk much about it. But again, for us as surgeons, was a huge in our clinic. It was a huge change, and this is a first transradial we did a couple of years ago with the help also of the Italian hand and Christian Cipriani. And then at the same time, as I said, we pushed for the hand transplantation project, which is mainly indicated for bilateral and quadri amputees who have tried to use their prosthesis, but they haven't been successful, or they still have much concerns that they really want to have something more, something that can give a better touch and a better appearance to their relatives. So we started the program in 2013, and we've met this patient that was a quadri amputee after a sepsis, and due to that sepsis, she got an amputation to all 4 limbs. I can't really go faster than this, but we took few videos just where she wanted to show how difficult sometimes was to do, simple things. And she was very much, she tried, actually she was very active with her prosthesis since the beginning, but she had very much problems in the common things with the phones, for example, or pick up things from the wallet. Showering, that was one of the biggest problems, just brushing her teeth. She brushed her teeth by herself for the first time after 8 years after transplantation, so she had all the time help from her husband. And simple things, but they it was a huge challenge for her. She trained very much, and I'm grateful to Maria and the whole group that helped with the training with augmented reality to train her muscles before surgery. And there was a great application of augmented reality during the process. We went to her home to see how she would cope with things that, in the house, in the kitchen. And sometimes it was a struggle just to see her. Again, it's definitely more acceptable with unilateral, but with bilateral, the challenges are obviously more important. And that's why she always asked for having a double hand transplantation. We did surgery in December last year. We took both arms from a donor from the elbow level, and then we did the osteosynthesis and all other connections. And this is the time where we revascularized the hand. It was many of us as surgeons have done a replantation, of course, and I think this was mainly a very emotional moment compared to other usual replantation, let's say. I think it was just very interesting to see a person that had no hands before having new hands again and starting rehabilitating. So it was very inspiring, and again, technically speaking, it's something that most of us as microsurgeons have done already. But these particular cases are probably emotionally different. And this is 3 months after surgery. She still had anti-claw splints in her hands. And we were waiting for intrinsic muscles to come back. She just sent a video yesterday or Friday last week where actually she has improved extremely much actually now with intrinsic minus deformity, and so she's starting wearing no anymore these planes. So some reinnervation of the intrinsic have already come, as well as sensation. She has had, and this is just interesting, a couple of weeks ago she sent a picture of how she was trying to coordinate and move independently each finger. And we were very lucky to find also a good color match. And these are our wonderful therapists, Annika Dolgren and Maria, who helped her very much. This is a slight rejection she had 4 months after surgery, those small red spots that was treated locally and by higher dose of corticosteroid. But again, what I really grateful is the collaboration that we have with the Max team, both in transplantation and in the robot arm project. And I just thankful for his team and our team in the hand surgery department. So thanks a lot for this great adventure. Thank you.
Thank you, Paolo. We don't have questions. Thank you a lot.
Thanks.